dear friends, first of all, once again, allow me to thank all organizers to give us a chance to be here with you, with this wonderful team, and to share your big European experience and to bring this experience in my country that is till this time in neighborhood of European Union. Now allow me to give a little presentation regarding Georgian Cancer Registry. So in 2022, the global burden of cancer across all sites included 20 million new cancer cases, of which 51% were in men and 49% in women. The 5 most commonly diagnosed cancer sites globally in 2022, lung, breast, colorectal, prostate, and stomach cancer. 10 million deaths, including more than 5 million among men and more than 4 million among women. The 5 leading causes of cancer death globally in 2022 were lung, colorectal, liver, breast in women, and stomach cancer. Cancer is the leading cause of death worldwide. By 2050, based on projected population growth, the number of cancer cases is expected to rise to 35 million. Approximately 70% of cancer-related deaths occur in low and middle-income countries. 1/3 of cancer deaths are attributed to 5 major behavior and dietary risk factors that are overweight and obesity, low consumption of fruits and vegetables, low physical activity, tobacco use, alcohol consumption. Tobacco use is the most significant risk factor for cancer development and accounts more than 22% of all cancer deaths. In low and middle countries, up to 20% of cancer cases are attributable to infectious agents such as hepatitis B and C, viruses, and human papillomavirus. Cancer poses a significant economic burden in all countries, including both healthcare system costs and productivity losses due to disability and premature death. With the rising cost of cancer treatment, prevention and early detection are gaining increasing importance as a cost-effective strategies to reduce the burden of the disease. Among low and middle-income countries, only 1 in 5 has the necessary evidence base to develop and implement effective cancer control policies. Burden of cancer in Georgia. In 2022, more than 30,000 new cancer cases across all sites were registered in Georgia. And the most common cancer types in Georgia were breast cancer, lung cancer, colorectal cancer, prostate cancer, and stomach cancer. In the same year, more than 8,000 cancer-related deaths were recorded in Georgia, 55% among men and 45% among women. The leading cases of cancer mortality in Georgia were lung cancer, breast cancer, colorectal cancer, stomach and prostate cancer. The Soviet-era system of managing oncology patients was based on dispensary surveillance, focusing on preventive care, continuous monitoring, and centralized management of chronic diseases, including oncology. It was particularly effective in ensuring that cancer patients and at-risk population received regular care and follow-up. The dispensary system was hierarchical and worked at multiple levels. Local polyclinics handled initial screening and referrals. Regional oncology dispensaries provided specialized care and maintained registries for the jurisdiction. National Cancer Institute focused on advanced treatment, research, and setting national protocols. oncology dispensaries were established in cities and regions of Georgia, functioned as a primary centers for cancer diagnostic, treatment, and follow-up, and worked in coordination with general polyclinics and hospitals to refer patients for specialized care. Dispensary model was an example of integrated care delivery, providing a range of services including diagnostic evaluations, outpatients treatments such as chemotherapy or radiotherapy, referrals to specialized hospitals for surgery and complex procedures, psychological and social support for patients and their families. The dispensary model of healthcare, including the application to oncology in the Soviet Union, focused significant challenges related to the information technologies due to the limited technological capabilities of the time and the centralized nature of the system. In the past decades, after the Soviet Union collapsed, the healthcare system of Georgia have undergone several structural and organizational reforms, moving from state-owned, centralized dispensary system to privatization to public-private partnership. The format for recording cancer care, originally designed for use to the oncology dispensaries, proved unsuitable for single doctors working in private clinics. As a result, data reporting significantly declined, leading to incomparable information to distort incidence of the country as true cancer burden. Georgia relied on international expertise to plan improvement in cancer data. Majority of European countries had already implemented cancer registries, which made it possible to determine the true burden of cancer incidence. According to the leading institutions' expertise, only through the registry data became it possible to reveal the true burden of cancer and evaluate the services provided to oncology patients and the screening programs. The completeness of registry data are presented. You can see all the data. In Georgia, the estimated completeness of Georgian Center Register of Georgia Cancer Registry in 2022, based on global expected and country observed indicators were around 83%. So, to address above mentioned challenges, the Georgian government initiated to develop a population-based cancer registry. This effort aims to establish a comprehensive and accurate system for collecting and analyzing cancer data. Ensuring a clear understanding of the country's cancer burden and improving the planning of cancer control strategies. The National Center for Disease Control and Public Health, we call it NCDC, has been entrusted and initiating the process of implementing a cancer registry. Their responsibility includes coordinating and development of the registry, establish data collection protocols, and ensuring the integration of the registry with national system by leveraging the expertise. The NCDC aimed to support the creation of the reliable and comprehensive system of monitoring the cancer burden effectively and facilitate data-driven decision-making for cancer control. The development of implementation of the Georgian Cancer Registry involved the following activities: establishing the legal and regulatory framework, developing infrastructure and technology capacity building and training, integration with existing health system, public awareness and stakeholders in engagement, piloting and scaling up, monitoring and evaluation. Since January 2015, the Cancer Registry has been implemented across the country. The system contains 71 variables, number of providers about 213, including 31 pathological anatomical labs. The total number of cancer per year is 30,000. The total number of new cancer cases per year are 11,000. The primary objectives of Georgia's cancer screening registry includes systemic data collection, gathering comprehensive information of new cancer across the country to establish a reliable database for analysis. Epidemiological analysis, understanding cancer patterns, trends, and risk factors written in the Georgian population to inform public health strategies. Policy development and evaluation, providing evidence-based data to support the formulation and assessment of cancer control policies and programs. The implementation of the Cancer Registry in Georgia aligns with global health initiative and underscores the country's commitment to addressing the cancer burden through informed decision-making and resource allocation. When the registry was first introduced, notification of new cancer cases was manual and paper-based, which result in incomplete case notification and missing variables in registration forms. The staff managing the registry, whose number remains limited on this day, had to make additional requests to medical facilities. In 2019, NCDC solved the issue by launching the Unified Electronic System for cancer data. Start collecting data electronically and combine information on cancer screening, diagnosis, and treatment. The Unified Electronic System is also used for the National Cancer Screening Program for cervical, breast, and colorectal cancer screenings. Through this system, target population are invited to the regular screenings after screening at first time. This system stores detailed information about screening procedures, the result, and calculates indicators used to assess screening performance, outcomes, and participation of target population. The unified system also supports better management of cancer patients. After the obtaining patients' consent, physicians have access to the patient's electronic data. The unified system is also connected to the birth-death module, and the patient's life status is updated in real time, which enables the calculation of survival rate. Many countries faced challenges in transitioning from paper-based system to digital registries, which requires substantial investment in technology, training, and infrastructure. While some countries, like the Baltic states, modernized very quickly, others struggled with understanding and fragmented healthcare system. Modern healthcare system that evolved from the dispensary model have benefited from the introduction of IT. This establishment of the population-based cancer registry in Georgia has been a significant step toward enhancing the country's capacity to monitor and control cancer incidence and outcomes. After 2 decades of challenges and inaccuracies, the true scale of the number of new cases and the total number of people living with cancer helping identify. Georgia's cancer registry improves access to high-quality data to assess survival rate and adapt public health strategies. In 2020, 5 years after introducing a population-based cancer registry in the country, the National Center for Disease Control and Public Health was able to access for the first time the 5-year survival rate for different types of cancer, the achievement which was hailed as an outstanding success by the INPHA General Assembly, opened up the possibility to identify gaps in cancer case and adapt cancer control in the country. Also, cancer survival depends on the patient's access to effective medical care, their tumors, age, gender, and comorbidity. Survival rates are considered the main indicators for cancer management and care. For the first time, it became possible to access the real regional distribution of cancer. Prior to the implementation of the cancer registry, case distribution was based on the healthcare facilities where patient receives service as these institutional provided. One of the significant achievements of the cancer registry is the ability to monitor the stage of the patient's treatment, follow up since all subsequent interventions linked to the patient's initial record in the registry. Improvement of epidemiological surveillance, ability to have real-time and reliable information on cancer at the country level, cancer patient service provision follow-up using personal ID, ability of tracking cancer trends over time, helping to measure the effectiveness of the intervention, geographical distribution of case, geographic variations of cancer type, aiding in the understanding regional and environmental risk factors. Tool for assessment of implementation of cancer prevention and screening program, ability of monitoring treatment outcomes and survival rates, supporting improvements in digital care, in clinical care. So this table represents the overall comparison of cancer data collecting before and after the introduction of our cancer registry. And the cancer registry data in Georgia has undergone multiple evaluation by international institutions. And data from 2015 to 2018 were assessed by International Agency for Research of Cancer, by IARC, and data from our registry were included in the publication Cancer in 5 Continents. In 2019, the registry was evaluated by Cancer Survival Group at the London School of Hygiene and Tropical Medicine in order to importance them in a Venus scanner. In July 2019, country visited to review cancer control activities in Georgia was performed by WHO IARC experts. In 2023-2024, in the frame of City Cancer Challenge Project, improvements of the cancer registry data quality for better decision-making, the cancer registry underwent a comprehensive evaluation. And in December 24, the project assessment of the Unified National Cancer Registry and identification of needs for its improvement, focused by the Czech Developing Agency, aimed to evaluate in the Unified Electronic Cancer Registry from an information. The procedures improvement in cancer registry fall in two main categories. The first of them is resolving existing technical issue, and the second one, implementing additional functionality. Not all healthcare providers consistently report cancer cases. The cancer registry incorporates a complex two-tower personal data protection system, which allows healthcare providers to access a patient's previous treatment history, but only which the patient's, if a patient allow it. To facilitate this, the patient receives an SMS code via the registry, which they must share with their doctor. And finally, this highlights the need for the streamlined process to ensure more effective and comprehensive care registration. And the limited data integration with interoperability with the other health information system, lack of real-time data exchange, quality and standardization of data, in consumption used to international classification system, TNM system, variation in diagnostic coding practices across institutions, influence human resources, shortage of training cancer registry personnel, and limited opportunities for professional development and trainings. Technical infrastructure. Outdated or non-unified software system, limited use of electronic reporting tools, absence of strong legislation, mandates to enforce complete reporting. Privacy concerns may restrict data sharing and linkage. Dependence on short-term or project-based funding. Challenges facing the cancer registry in Georgia. Public and provider awareness. Low awareness among clinicians and administrators about the importance of the registry data. Lack of motivation among healthcare providers to enhance statistical reporting and inaccurate registration, even to cases eligible for state funding. And the use of cancer registry data for planning, research, and quality improvement. Challenges facing to the cancer reporting in Georgia. Data use and dissemination, difficulties in timely implementation of various changes, additional to new validations, lack of necessary standardized reports, difficulties in receiving different reports on time, limited analytical capacity to translate registry data, few public reports or dashboards for policymakers or researchers, geographical disparities in data, complaints, incomplete coverage of vulnerable or morbidity population or mobility population, and soft analysis, strengths, legal system for cancer registry and standard reporting formats are in place. Reporting includes all health settings independently of the type of the ownership. Data collecting tools are available online. SOAP for cancer registries developed and disseminated among health providers. Cancer registries is linked with relevant state programs database. Weaknesses: quality of data, completeness, accuracy, comparabilities, lack of human sources, outstanding and irrelevant IT technologies, opportunities, assessment of quality of cancer registration process, identify gaps and producing the appropriate recommendation with IARC, field research of the cancer-related vital events investigation, death certificate only, and stress, low education or motivation of professionals in the field of statistical reporting. So, key recommendation for the future development of the Georgian Cancer Registry: policy reforms, registry content, data quality, integration with electronic health records and other health information systems, automated data integration, adoption of international interoperability standards, standard-side reporting with deep involving of experts or an expert boards in the process of preparing the annual analytical report of case, analytical capacity to facilitate a shift toward predictable models, monitoring of evaluation indicators should be defined, data protection mechanism should be revised. So, thank you.